In a second. Right now, though, Dr. Stephen Badylak, how are you?
I'm fine, thanks.
You're with the University of Pittsburgh, right?
That's right.
How's the morale there today?
Productivity in the lab will drop significantly this 2 weeks.
You're going to be featured on part of a show on Nat Geo tonight at 10 o'clock. You're also professor of the Department of Surgery at McGowan Institute for Regenerative Medicine, and that's what it's about, how to grow a heart.
Right, hearts and other organs and tissues. That's what we do for a living.
This is incredible. So we went from a situation where you would have donors, somebody would die, or in the case where they could sustain life without tissue or organ, we would take those and transplant them in somebody. But now you're saying you can actually just grow them. Well,
it's not just hearts. It's all tissues and organs. And the problem with whole organ donors is that the need far outstrips the supply, right?
Mm-hmm.
It's almost like 70-1 for most organs. So a lot of people die waiting. And so the field of regenerative medicine, in part, is addressing that particular problem, but also things like if you have the type of injury that right now people assume you can never regrow functional tissue, we're asking, is that really true? You have a stroke. Most people would say, well, okay, we've lost that part of the brain, we're never going to get it back. You have a heart attack, lost that part of the heart, let's hope we got enough left. And the whole concept is, can we change the way we heal from forming scar tissue to actually regrowing functional tissue?
So would you grow tissue or organs that are based on somebody else's tissue, or would I donate my DNA and then you would grow it from there? How does that work, or would it be both?
Yeah, well, it's much more the latter, where you use your own cells. And a typical approach, though, and if you see the show, they do an outstanding job of describing the different approaches. But let's say you needed a liver because you're on a one-way street and it doesn't look good for you getting a donor organ. The doc would take a sample of either your bone marrow or your blood and isolate the stem cells that you have floating around in your body, and then put those cells onto an appropriate type of a scaffold that would have signals in it that tell those cells when they put on that they should become liver cells rather than something else.
Oh.
And then those grow for a little bit outside the body in some sort of a special incubator. Then they get put into you, and they take off from there to form new tissue for you. So for organs like the liver, so you would basically regrow functional, healthy liver tissue from your own stem cells while your other organ is failing, and that way you don't have to wait on somebody else for a donor.
Just as a side question, livers will partially regenerate anyway, won't they? Livers do?
Yeah, they will. There's only about 4 or 5 tissues in the body where you truly get regeneration. The liver's one. But, patients that have got cancer or have got cirrhosis and some of these advanced liver diseases, they need a transplant because there's not enough healthy tissue left to regenerate the bone. But the kidneys do not regenerate. The heart does not regenerate. Lungs do not regenerate.
So if you're using my own cells, does that cut down any rejection? Do I not have to take anti-rejection drugs?
That's the whole reason for using your own. Mm-hmm. That way you can use your own cells and there's no rejection. You don't need to take medicine every day. And the great thing about the approach is that there's some things that are actually quite successful now. I think National Geographic did a great job of showing what's currently available and some of the patients who've received therapies for muscle replacement, or they've had their whole bladder replaced, or and those things that are on the cusp of in the future, replacing your lungs, replacing your liver, kidney, heart, these sorts of things. Right now we can grow skin in a bottle. Docs can take skin off the shelf and treat burn patients with it, or treat patients that have got non-healing ulcers. So some things are already there, some things are right on the cusp and happening now, and other things are in the near future.
How long is it till it will become commonly used? If somebody's on a waiting list for a kidney or something right now, does this give them hope, something within the next year, 2, 4?
Well, it depends on the tissue or organ. hearts you're not going to see in a year or two. I think the first organs that you're going to see are the liver and the lungs. And those, I think there's a very real chance you'll see the first humans implanted with those within 5 years. The skin, like I said, is already available. The problem with the heart is it's so challenging because you can't have a partially functioning heart when you put it in and let it continue to grow while you're there. You have to have something that works 100% from day one. And so that's a very challenging one. But what you will see in the show is an actually functioning, beating heart in a laboratory. The challenge now is to take it from the laboratory, put it into the patient.
I wonder if you could use some sort of artificial heart technology in the interim,
right,
while you're doing something.
Right, as a bridge to transplanting this, exactly, just like they do now when they're waiting for the donor organ. It's an exciting field. There's a terrific number of very talented people in it. Over 3,000 scientists worldwide working on these problems because it's taken off so well. And when you get that many talented, motivated people working on something, good things tend to happen.
That's got to feel amazing to you to be a part of something like this that will do so much good for people. That's got to be incredibly gratifying.
Oh, I've got the best job in the world. I can honestly tell you, I look forward to going into work every single day. And to work with, and we're just one of many people that are doing this. And to see these patients, like you'll see on the show, where we've changed their quality of life, that beats publishing any paper or getting any grant because it's what we're really trying to do.
So you say lungs and liver probably first to be commonly used. So the message here, I guess, is go ahead and drink and smoke, and you're coming to save us, right? Probably not the message you want out there.
Right. I probably won't sign off on that.
Okay, very good. Well, thanks for coming on, and thanks for doing all you're doing. That's amazing.
Yeah, good. Thank you. Have a good day.
Dr. Stephen Badylak, and you can see the entire program tonight on Nat Geo. Explore how to grow organs with Nat Geo. Fascinating stuff. And if you're somebody that is going through some of this, man, there is definitely some hope there. Let's see, it airs tonight at 10 p.m. on the National Geographic Channel, 10 p.m. Eastern Time. How to build a beating heart. Can you imagine going on the laboratory and seeing the heart beating there? Imagine be the guy that cleans up around there, the janitors. The hell are they doing in here? Mad scientists. You're thinking like Frankenstein stuff. It's Doc Thompson, 700 WLW.